Hello, thank you for joining us for the 2025 Health Benefit Exchange Security Training for HCA Volunteer Assisters. This is a mandatory training for all volunteer assisters whose username begins with N through HO. The training is about 18 minutes long. There will not be any tests or assessment following the webinar, so once the training has concluded, go ahead and exit. We will not be opening up the line for Q&A once the video has ended, so if you have questions or concerns, please email us at hcavolunteerassister@hca.wa.gov. Before we start the training, we would like to remind you that the Healthcare Authority highly encourages you to sign up for GovDelivery. This is an email or text system that provides you with agency and program updates. If you would like more information, again, email us at hcavolunteerassister@hca.wa.gov. Now that we have completed our announcements, we can start the training. Thank you and enjoy. Topics for today's training will be on purpose, security, privacy, security tips, and volunteer assister access. Purpose. This training is an annual requirement. It provides guidance on security and privacy practices for CMS and IRS compliance and to establish a baseline of security awareness for working with the Washington Health Benefit Exchange's web portal, also referred to as the Washington Healthplanfinder, and also to increase security and privacy awareness. Security. When you think of computer security, think of CIA, confidentiality, integrity, and availability. Confidentiality. Limit access and disclosure to authorized users, those what they need to know. Integrity. Limit the number of people or processes that can modify information in the system. Availability. Maximize system uptime and information availability to the right users. Privacy is an individual's right to control the use and disclosure of their own personal information. Individuals can assess a situation and determine how their data should be used. Privacy is the protection of customers or individuals and their personal information, for example, health and financial information. Although security and privacy overlap in some areas, they are very different. Security is the protection against threats or danger, and privacy is the right to control how your information is viewed and used. The picture shows the overlap of protecting personal information. Both security and privacy have the responsibility to protect personal, confidential, and sensitive information. Security questions and answers. What is the purpose of this training? CMS compliance, protecting personal identifiable information, PII, security and privacy awareness. Who is the weakest link in any security program? People. Who is responsible for security? Everybody is. What information is critical for us to protect? All information we receive, particularly PII, personal health information, PHI, personal care information, PCI, and federal tax information, FTI. Where should you store electronic Washington Health Benefit Exchange information? Network drives, OneDrive. With whom can you share critical Washington Health Benefit Exchange information? Only people that need to know. With whom can you share your password with? No one. Who would you contact if there is a security incident to report? Your HCA point of contact is HCA Volunteer Assister at hca.wa.gov. Security tips. Use secure network drives instead of local hard drives. Do not share your passwords or write them down. Do not post confidential or sensitive Washington Health Benefit Exchange information on any social networking site. Erase confidential information from whiteboards. Protect PII as if it were your own. Practice need to know. Who is responsible for protecting personal information? Everyone who becomes a volunteer assister with Access and Healthplanfinder and users of information technology systems are equally responsible for security and privacy. You are responsible for the information you handle every day. It's everyone's responsibility to keep our systems and information secure. No one is exempt. Threats. Types of threats. Types of threats include social engineering, phishing, spear phishing, tailgating, pretexting, vishing, insider threats, weak passwords, misdirected, unsecure emails, oversharing information. People are the weakest link in computer security. These types of threats are not unique to Washington Health Benefit Exchange. Many public and private organizations with confidential information face the same type of threats. Social engineering uses persuasion or influence to deceive personnel into divulging confidential information or allowing the adversary to perform unauthorized actions. Examples include phishing, which are deceptive emails sent by bad actors, websites, and text messages that are used to steal information. Spear phishing, attacks that target specific individuals or groups within an organization. Tailgating, when someone without proper authentication follows an authenticated employee into a restricted or protected area. Opening malicious emails. The impact of opening an attachment that is included in a malicious email can be very dangerous and expensive. The attachment may include a keylogger or install ransomware. Keyloggers steal personal information such as usernames and passwords, take periodic screenshots, grab sent emails, or harvest credit card numbers and bank details. Ransomware is a type of malware attack that prevents or limits users from accessing their systems by locking the system screen or the user's file until the ransom is paid. Identifying malicious emails. You can tell if an email is malicious by looking at the subject and the contents of the email. Check for spelling errors. Hover over the link to read the URL. No senders or multiple senders in the email. Look out for poor grammar. Check sender email address. Do you recognize the sender? Insider threats. Too often people associate the term insider threats in cybersecurity with malicious employees intending to directly harm the company through theft or sabotage. In truth, negligent employees or contractors unintentionally cause an equally high number of security breaches and leaks by accident. Insider threats is defined as an insider using their authorized access wittingly or unwittingly to do harm to the security of organizational operations and assets. Information. Personally Identifiable Information, PII. Per CMS, PII is anything that could individually or in combination with other data elements identify the consumer, such as a consumer's name, address, telephone number, social security number, marketplace application ID, or other identifier. Do not share client PII with others. Limit access and disclosure to authorized users, those with a need to know. When in doubt, contact your supervisor or your HCA volunteer assister point of contact. Personal information collected are the applicant or person's information, such as their name, address, zip code, phone number, date of birth, social security number, ethnicity. Household can include their spouse, children, dependents, relationships, medical condition, and income information. A person's email, username, address, phone number, business, plan enrollment, citizenship, and incarceration status. Sources of information may include Washington Healthplanfinder, paper applications, Federal Data Services Hub, DSHS, letters and correspondence, appeals, contracts and agreements, issuers, carriers, brokers, navigators, sponsorship representatives, requests for Washington Healthplanfinder user accounts. Unauthorized disclosure penalty. Per 45 CFR, improper use and disclosure of information including PII. Any person who knowingly and willfully uses or discloses information in violation of Section 1411G of the Affordable Care Act will be subject to a civil penalty of not more than $25,000 per person or entity per use or disclosure, in addition to other penalties that may be prescribed by law. Per the User Access Agreement. The terms and conditions of this agreement will remain in effect after I leave my current position. I will not disclose confidential, personal, and financial information that I obtain while working in my position. I understand that any breach of this provision of this agreement will subject me to disciplinary action, including the immediate termination of my access to a health plan finder and termination of my position. I understand that this Washington Health Benefit Exchange user access agreement must be renewed at the completion of security and privacy refresher training annually and thereafter. Prevention tactics. Examples of strong password characteristics are upper and lowercase letters, a minimum of one special character, at least 15 alphanumeric characters long. Random passwords and passphrases are the best defense in protecting sensitive information. Never use personal information such as a person's name or birthday. Don't use the same password for all accounts. Don't share or write down your passwords. Sending secure emails. Sending client PII via email should be avoided. If necessary, PII must be sent via encrypted emails only. Before sending such emails, verify recipients are authorized to receive such PII and need to know. Avoid sending PII, but if necessary, encrypt it. You will need to engage your own IT resource for assistance with an encryption process that works with your email system. Incident. Incidents include the loss of data through theft or device misplacement, loss or misplacement of hard copy documents, and misrouting of mail or email, all of which may have the potential to put the data at risk of unauthorized access, use, disclosure, modification, or destruction. What is a breach? An incident becomes a breach when there is the loss of control, compromise, unauthorized disclosure, unauthorized acquisition, unauthorized access, or any similar term referring to situations where persons other than authorized users and for another than authorized purposes have access or potential access to PII or federal tax information, FTI, whether physical or electronic. Here is a list of common vulnerabilities: casual handling of confidential information, loss or theft of laptop device. When including screenshots, make sure that no PII is visible, too much access, losing employee access badges, non-compliance with policies, procedures, standards, and regulations, and piggybacking, as well as unauthorized or unintended disclosure of PII when sending unsecure emails. There is no need to put any client information found from other sources like phone number, address, etc. Minimize putting PII in tickets by describing the problem, not the people, using anonymous data such as the application ID or person ID. Do not put social security numbers, not even the last four. Never post any kind of user or individual lists in the tickets. Publicly accessible information. All shared materials must not contain confidential content such as PII, IT system settings, consumer-specific information. Do not post company-specific information, consumer-specific information, or PII on social media. For more information, please visit the link listed on this slide. Security incidents and your role. If you see something, say something. If you become aware of an incident, contact the Washington Health Benefit Exchange Security immediately at securityincidents@wahbexchange.org. Assisters, be sure to also keep a copy for your lead organization. Volunteer Assister Access. In order to become a volunteer assister, you must be affiliated with an organization and complete all 7 modules of the community-based training, request a training assessment test at HCA Volunteer Assister at hca.wa.gov, complete and return the test to the same email address. Upon successful completion of the test, the Healthcare Authority will email the Volunteer Access Registration Packet, Community Partner Registration Form, Washington State Background Check, and Washington Health Benefit Exchange User Agreement. Once approved, you will be granted volunteer access in Washington Healthplanfinder. Washington Healthplanfinder Account Reminders. If there has been no activity on your Washington Healthplanfinder account in 60 days, your access will be disabled. Passwords for Washington Healthplanfinder expire every 60 days. Resources. Please see the link on this slide for Healthcare Authority training and education. You can contact us at HCA Volunteer Assister at hca.wa.gov, and you can contact the Washington Health Benefit Exchange at wahbexchange.org. Congratulations! This concludes the mandatory safety training. Thank you for joining us for this webinar. Please email us at hcavolunteerassister@hca.wa.gov if you have any questions. Have a great day.